Welcome to Weekly Neurology Deep Dive. This deep dive is for educational purposes only
Hmm.
and has no commercial endorsements today. Today we're going to be diving into a recent paper that sort of reveals how Sjögren's disease, which is a condition we often associate with dry eyes and mouth, can actually manifest in the central nervous system. We're going to be exploring diversity of central nervous system manifestations in Sjögren's disease, a case-based review, which was published in Rheumatology International. Just as a quick overview, we strongly recommend reading the full paper for a deeper dive.
It's a fascinating paper, and it really highlights a crucial point. Many neurologists might not realize just how prevalent neurological complications are in Sjögren's disease.
Yeah. So let's jump right into that. The paper throws out some pretty staggering statistics, right?
Yes, it does. Studies estimate that anywhere from 8.5% to 70% of Sjögren's patients experience neurological involvement. That's a huge range, which speaks to the complexity.
Of diagnosis. Yeah. It's a real eye-opener. Now imagine this. A patient comes to your office with what seems like a straightforward neurological issue, but it turns out to be linked to Sjögren's disease. The paper actually emphasizes that these neurological symptoms can sometimes show up before the classic dryness symptoms.
That's right, and that's what makes early diagnosis so tricky. If we're not actively considering Sjögren's, we could easily miss the connection, especially in those cases where the classic symptoms haven't even emerged yet.
Right. Let's delve into the central nervous system specifically.
Mm.
The paper focuses on the diverse ways that Sjögren's can impact the CNS. And it's not just Sjögren. The peripheral nervous system involvement we often hear about. They're talking about a spectrum that ranges from mild headaches and migraines to conditions like meningitis, seizures, and even MS-like lesions.
The range of CNS manifestations is really quite astonishing. And we're not just talking about those dramatic, acute presentations either. The paper also points to cognitive impairment as a significant concern with Sjögren's patients, experiencing memory deficits, difficulty concentrating, and problems with executive function.
These are subtle symptoms that could easily be misdiagnosed or attributed to other factors, particularly in older patients. It really underscores the need for a heightened awareness of Sjögren's in neurology.
Absolutely. The paper goes on to present 5 case studies that illustrate just how varied and often unexpected these CNS presentations can be. For example, there's the case of a 47-year-old man who came in with severe headaches, altered consciousness, and speech difficulties. Initially, he had been diagnosed with dry eye syndrome years prior, but it was only after these more severe neurological symptoms emerged that a salivary gland biopsy confirmed Sjögren's.
So in this case, the neurological symptoms were actually the red flag that ultimately led to the correct diagnosis. It seems like taking a thorough medical history is absolutely crucial, even if the presenting symptoms seem unrelated to Sjögren's at first glance.
It is. There's another case that really highlights the importance of not dismissing seemingly minor symptoms. A 50-year-old woman with a history of epilepsy experienced a seizure, followed by persistent confusion, hallucinations, and mood swings.
It sounds like a classic case of epilepsy. So what's the connection to Sjögren's?
Well, upon further investigation, it turned out she also had a history of recurring joint pain, muscle weakness, and swollen lymph nodes. These seemingly unrelated symptoms, coupled with the unusual post-seizure behavior, prompted further investigation, and eventually, Sjögren's was confirmed.
It makes you realize that what might seem like a straightforward case can actually have a more complex underlying cause. We really need to be thinking about Sjögren's as a possibility, even when the presentation isn't textbook.
Precisely. Another intriguing aspect highlighted in the paper is the link between Sjögren's and Parkinsonism. There's a case study involving an 62-year-old woman who, 9 years after her initial Sjögren's diagnosis, began experiencing muscle inflammation, myositis, and later developed Parkinsonian symptoms.
So could Sjögren's have actually triggered or contributed to her Parkinsonism?
It's an interesting question, and the paper suggests a possible link. The fascinating part is that when her Sjögren's was treated, her Parkinson's symptoms actually improved, hinting at a connection between the two conditions. This raises important questions about the potential interplay between autoimmune processes and neurodegenerative disorders.
That's remarkable. It really expands our understanding of the potential reach of Sjögren's and its impact on the nervous system.
Indeed, and we can't overlook the psychiatric dimension of Sjögren's either. The paper discusses how Sjögren's can manifest as depression, anxiety, psychosis, even dementia and personality changes.
This adds another layer of complexity to diagnosis, doesn't it? These symptoms could easily be mistaken for primary psychiatric disorders.
Absolutely. differentiating between primary psychiatric conditions
Well, yeah.
and those secondary to an underlying autoimmune condition like Sjögren's can be incredibly challenging.
So given this wide array of potential CNS manifestations, how do we even begin to diagnose Sjögren's involvement in these cases?
The paper acknowledges that there's a lack of standardized diagnostic criteria, specifically for CNS involvement in Sjögren's, which makes diagnosis particularly tricky.
So are we relying solely on clinical judgment? What tools do we have at our disposal?
We still utilize the traditional diagnostic tools for Sjögren's, blood tests for antinuclear antibodies, ANA, immunoblot testing to detect specific antibodies, the Schirmer test to measure tear production, and saliva flow tests.
And of course, the gold standard, the salivary gland biopsy.
Exactly. Examining the salivary glands for characteristic lymphocytic infiltration remains a crucial step in confirming the diagnosis of Sjögren's. But when it comes to CNS involvement, we need to go beyond these standard tests.
The paper mentions brain MRI as a valuable tool. What can we expect to see on imaging?
Brain MRI can reveal a range of abnormalities suggestive of CNS involvement, including white matter hyperintensities, lesions that mimic those seen in multiple sclerosis, atrophy, evidence of infarctions, and other structural changes.
And what about CSF analysis? Can that provide any clues?
Yes, CSF analysis can be very helpful. We might see elevated protein levels, pleocytosis, which is an increase in white blood cells, and sometimes even specific antibodies that point towards an autoimmune process affecting the central nervous system.
So it sounds like diagnosing CNS involvement in Sjögren's really requires a multifaceted approach, combining the patient's history, clinical presentation, lab tests, imaging, and CSF analysis.
You've hit the nail on the head. There's no single test that definitively diagnoses CNS involvement in Sjögren's. It's like piecing together a puzzle, and it requires careful and comprehensive evaluation to arrive at the correct diagnosis.
Let's talk about treatment. What does the paper recommend for managing CNS involvement in Sjögren's?
The paper emphasizes that there aren't any standardized treatment guidelines specifically for CNS involvement in Sjögren's, but the mainstay of treatment typically involves immunosuppressive therapies.
What types of medications are we talking about here?
The most common are corticosteroids, like prednisone, which are effective at quickly reducing inflammation. We also use disease-modifying anti-rheumatic drugs, or DMARDs, such as azathioprine, cyclophosphamide, methotrexate, and hydroxychloroquine. These medications work by suppressing the overactive immune system.
The paper also mentions biologics, like rituximab.
Yes, biologics are a newer class of drugs that target very specific components of the immune system. Rituximab in particular has shown some promise in treating both Sjögren's itself and the complications associated with it.
And finally, there's intravenous immunoglobulin, or IVIG.
Right, IVIG is essentially
Okay.
a concentrated solution of antibodies that can help modulate the immune response. Is often used in cases where other treatments haven't been effective, or if the patient can't tolerate them.
So it seems like there's no one-size-fits-all approach to treatment. It really depends on the specific CNS manifestations,
Yeah.
the severity of the condition.
And the individual patient's overall health and tolerance.
Exactly. It requires careful consideration
Yeah.
and close monitoring to find the treatment regimen that will be most effective
Exactly.
and tolerable for each patient.
Before we move on to the paper's recommendations for improving the diagnosis and management of CNS involvement in Sjögren's, I want to pause for a moment and ask you, what are your initial thoughts on all this? What stands out to you as a neurologist? Who's going to be applying this knowledge in clinical practice? What really strikes me is just how often we might be overlooking Sjögren's as a potential cause of neurological symptoms. The sheer variety of ways it can manifest in the CNS means we need to broaden our thinking and be more vigilant in our assessment.
I agree. It's a reminder that we can't afford to make assumptions or dismiss seemingly unrelated symptoms. We need to be asking the right questions and considering Sjögren's as a possibility, even in cases that seem straightforward at first.
Absolutely. Taking a thorough history, listening carefully to our patients, and being aware of the subtle clues can make all the difference in reaching an accurate diagnosis and initiating timely treatment. Now let's shift gears a little and look at what the authors recommend for improving the diagnosis and management of CNS involvement in Sjögren's. Not surprisingly, they highlight the urgent need for more research in this area.
More research? What kind of research are we talking?
Well, for one, they call for the development of standardized diagnostic criteria, specifically for CNS involvement in Sjögren's. Right now, as we've discussed, diagnosis is heavily reliant on clinical judgment which can be subjective and lead to inconsistencies and delays.
So having clear, standardized criteria would help streamline the process, ensure earlier diagnosis, and ultimately lead to better outcomes for patients.
Precisely. They also stress the need to raise awareness among neurologists about the diverse neurological presentations of Sjögren's. We need to be better equipped to recognize the subtle signs, to know what questions to ask, and to include Sjögren's in our differential diagnoses, even when the presentation seems atypical.
It's almost like we need a paradigm shift
Yeah.
in how we approach neurological assessments, always keeping in mind that Sjögren's could be lurking beneath the surface.
Exactly. The authors go on to emphasize the importance of investigating the underlying mechanisms of CNS involvement in Sjögren's. We know it's an autoimmune disorder, but the precise pathways by which it affects the central nervous system are still shrouded in mystery.
So what kind of research could help us unravel these mechanisms?
Well, they suggest focusing on the role of specific antibodies, the inflammatory mediators involved, and the potential genetic factors that might predispose individuals to CNS complications. Unraveling these mechanisms could lead to more targeted therapies and perhaps even preventative strategies.
Sounds like we're at the tip of the iceberg in understanding how Sjögren's impacts the brain.
We are, and that's why these research recommendations are so critical, beyond the need for a deeper understanding of the disease process. The authors also call for long-term studies to track the progression of CNS involvement in Sjögren's and the effectiveness of various treatment approaches.
Having that long-term data would be invaluable. It would give us a clearer picture of the natural course of the disease, how it impacts patients over time, and what treatment strategies offer the most benefit in the long run.
Exactly. We need to know which treatments are most likely to slow disease progression, prevent further neurological damage, and improve quality of life for these patients.
You know, one of the case studies that really stood out to me was the case of a 62-year-old man whose initial cognitive decline was attributed to brain fog following a COVID-19 infection.
Yes. Case 5. A very intriguing case that highlights the importance of considering Sjögren's, even when a diagnosis seems obvious. Remember, this patient presented with a urinary tract infection, acute kidney injury, and anemia, but the cognitive decline was the most alarming symptom. His family attributed it to brain fog from a previous COVID-19 infection.
And at first glance, that seems like a reasonable assumption. We're all too familiar with the long-term effects of COVID-19.
Right. But further investigation revealed some surprising findings. Blood tests showed the presence of anti-nuclear antibodies, ANA, at a high titer. And he tested strongly positive for antibodies against SSA and SSB, which are highly suggestive of Sjögren's. A salivary gland biopsy confirmed the diagnosis.
So his cognitive decline wasn't just a lingering after effect of COVID-19. It was actually a manifestation.
Precisely. And this case serves as a powerful reminder for neurologists. We need to be aware that Sjögren's can mimic other conditions, including post-viral syndromes. And we can't afford to jump to conclusions. Thorough investigation is key.
Especially in this post-COVID era, where we're still grappling with the long-term consequences of the virus.
Absolutely. This case highlights the importance of keeping an open mind, considering all possibilities, and not dismissing symptoms as simply being post-viral without proper investigation.
It's a lesson. In diagnostic humility, we can't let our assumptions cloud our judgment.
Now, beyond the specific recommendations for research and clinical practice, this paper also sends a broader message to the neurology community.
What's that message?
It's a call for greater collaboration between neurologists and rheumatologists. The authors argue that managing CNS involvement in Sjögren's demands
a multidisciplinary approach.
So we need to break down the silos between specialties and work together more closely. Absolutely. Neurologists and rheumatologists need to share their expertise and collaborate on the more diagnosis, treatment, and long-term management of these complex patients.
It makes sense. We each bring our own unique perspective
Yeah.
and knowledge base to the table. And by working together, we can provide more comprehensive
and coordinated care.
Precisely. This collaboration might involve sharing information, coordinating care plans, even considering joint clinics where patients can be seen by both a neurologist and a rheumatologist simultaneously.
It's all about ensuring that patients with CNS involvement in Sjögren's receive the most comprehensive and integrated care possible.
Exactly. And by fostering these collaborations, we can learn from each other, improve diagnostic accuracy, optimize treatment strategies, and ultimately improve outcomes for patients.
The paper emphasizes the need to think about Sjögren's more broadly, not just as a condition that causes dry eyes and mouth, but as a complex, systemic disorder with the potential to affect multiple organs, including the brain. It's a call to action for neurologists to expand our understanding of Sjögren's and its diverse manifestations, particularly those that impact the central nervous system.
We need to be asking the right questions, considering Sjögren's as a potential diagnosis in a wider range of cases, and working collaboratively with our rheumatology colleagues to ensure that these patients receive the best possible care.
And that brings us to one of the most striking points highlighted in the paper, the profound impact CNS involvement can have
Follows the lives
of individuals with Sjögren's.
It's one thing to discuss symptoms and diagnostic criteria, but it's another to truly grasp the human toll of this condition.
Exactly. The authors really bring this home. Through the case studies, they demonstrate how these neurological complications can affect every aspect of a person's life, from their ability to work and maintain relationships to their overall sense of well-being.
For instance, in case 2, the 50-year-old woman with epilepsy, her seizures and the subsequent confusion, hallucinations, and mood swings had a devastating impact on her mental and emotional health.
That's right. And we have to remember that these challenges can be just as debilitating as the physical symptoms of the disease.
So as neurologists, our responsibility extends beyond diagnosing and treating the disease itself. We need to be treating the whole person.
I couldn't agree more. We need to be attuned to the emotional and psychological needs of our patients, providing support and resources to help them cope with the challenges of living with CNS involvement in
This
Sjögren's.
might involve connecting them with therapists, support groups, or other resources that can address the emotional and practical aspects of living with this condition.
It's about acknowledging that CNS involvement in Sjögren's isn't just a neurological issue. It's a human issue that affects every facet of a person's life.
Now, before we move on to the paper's concluding remarks, I want to bring up a thought that wasn't explicitly mentioned in the paper, but builds on the themes we've been discussing.
I'm intrigued. What is it?
Well, we've been talking about the diagnostic challenges and the importance of a comprehensive approach.
Yeah.
But I think there's an even bigger picture here. It's about the evolving landscape of neurology itself.
I like where you're going with this.
As we uncover more about the intricate relationship between the immune system and the nervous system. We're witnessing a blurring of the lines between specialties that were once considered distinct, like neurology and rheumatology.
Conditions like Sjögren's, with its complex neurological manifestations, really underscore this point.
And I think this trend is only going to accelerate in the coming years.
Yeah.
We're going to see more and more neurological conditions that have an underlying immunological
It's the rise of neuroimmunology.
Exactly. And this means that neurologists need to be increasingly comfortable with concepts of immunology and autoimmune diseases.
Absolutely. Understanding the immune system will be as crucial for neurologists as understanding the nervous system itself.
And it also underscores the increasing importance of collaboration between neurologists and rheumatologists.
Without a doubt, the future of neurology, particularly in cases like Sjögren's, hinges on collaboration and a shared understanding of this intricate interplay between the immune and nervous systems.
So the message I want to leave our listeners with is this. Be open to new ways of thinking. Be willing to collaborate across specialties and be prepared to embrace the evolving landscape of neurology.
It's a call to action for all of us in the neurology community. The future of our field depends on it.
And with that, we'll wrap up part 2 of our deep dive. All right, so we've covered a lot of ground in this deep dive into CNS involvement in Sjögren's disease. Let's revisit the key takeaways from this paper before we sign off.
It's been a fascinating exploration. Where do we even begin?
Well, first and foremost, I think the paper drives home the point that CNS involvement in Sjögren's is more common than many neurologists realize. And it's not just limited to the peripheral nervous system.
That's a crucial point. For neurologists to grasp, we need to be thinking about Sjögren's as a potential diagnosis in a much wider range of cases than we might have previously considered.
And the range of ways it can manifest is truly astonishing, from mild headaches and subtle cognitive impairment to serious conditions like meningitis and MS-like lesions. The diversity of CNS presentations is quite remarkable.
It speaks to the complexity of the disease and the challenges we face in diagnosing it accurately and in a timely manner. The lack of standardized diagnostic criteria for CNS involvement further complicates the process.
So what can we do as neurologists
Yeah.
to improve our diagnostic approach?
The paper underscores the importance of being thorough in our evaluations. This means taking a detailed history, paying close attention to seemingly minor or unrelated symptoms, and utilizing a combination of clinical assessment, laboratory tests, imaging, and CSF analysis to arrive at the correct diagnosis.
It's about thinking broadly, being alert to the subtle signs, and remembering that not all presentations will be textbook cases. And when it comes to treatment, the paper highlights the use of immunosuppressive therapies. But there are no standardized guidelines, specifically for CNS involvement. Treatment decisions need to be individualized based on the specific manifestations, the severity of the condition, and the patient's overall health.
It's a reminder that each patient is unique, and we need to tailor our treatment approaches accordingly.
We also need more research to guide our treatment decisions. The authors call for long-term studies to track the progression of CNS involvement in Sjögren's and to determine which treatment strategies are most effective in the long run.
Absolutely. That kind of data would be invaluable in helping us understand the long-term implications of the disease and in developing evidence-based treatment guidelines.
And as we discussed earlier, the paper strongly advocates for greater collaboration between neurologists and rheumatologists. Managing these complex cases requires a team approach to ensure that patients receive the most comprehensive and coordinated care.
It's about breaking down those silos between specialties and recognizing that we can achieve far more. By working together, we need to leverage each other's expertise, share information, and develop integrated care plans that address the multifaceted needs of these patients.
And perhaps most importantly, we need to remember that behind every diagnosis, behind every case study, there's a human being whose life is profoundly affected by this condition. The paper does a great job of highlighting the personal stories of the patients and the profound impact CNS involvement can have on their daily lives.
It's a powerful reminder that our work as neurologists goes beyond diagnosing and treating disease. We need to be compassionate caregivers, attuned to the emotional and psychological needs of our patients, and prepared to offer support and resources to help them navigate the challenges of living with Sjögren's.
So as we wrap up this deep dive, I want to encourage our listeners to think critically about the implications of this paper in their own practice. How might this new knowledge influence your approach to evaluating patients with neurological symptoms? How can you integrate these insights into your diagnostic process, and how can you work more effectively with your rheumatology colleagues to ensure that patients with CNS involvement in Sjögren's receive the best possible care?
These are important questions for all of us to reflect on. The evolving landscape of neurology demands that we be open to new ways of thinking, willing to collaborate across specialties, and committed to lifelong learning.
It's been a pleasure exploring this fascinating and complex topic with you today.
The pleasure was all mine. And to our listeners, we encourage you to delve deeper into the full paper, Diversity of Central Nervous System Manifestations in Sjögren's Disease, a case-based review. Published in Rheumatology International, it's a thought-provoking read that will undoubtedly challenge your assumptions and broaden your understanding of this often overlooked condition.
And until next time, keep those brains engaged and keep exploring the ever-evolving world of neurology.